anyone listening to me right now, we have all endured or went through something that really shook us to the core. Let's say 1/4 of your life, you will endure some kind of mental health issue. Yeah, we are all the same.
My name is Doyin. I'm a psych practitioner. Welcome to Rethink Life with Doyin, where we unlearn to relearn.
Remember that story that I told you about the couple that went on a date, and the individual asked the couple about their family history when it comes to mental health. They wanted to know if if a certain medical or mental illness or condition runs in the family. And I get it. I get it. Listen, the question is valid, but I wanted to clear and expand on this topic because I feel like it's very important that we are aware of something. You're going to notice something by the time I'm done talking. So, oftentimes when people think of mental health, they think of, the genetic component. They think, okay, oh, once it runs in the family, someone has schizophrenia or bipolar, or they had depression or anxiety, right? That this will continue on also in the individual, or it can be seen in the individual. Let me explain something to you. Not saying that it cannot be carried or passed down or expressed in the individual. I'm not saying that. But oftentimes, just because you carry or it runs, just because it's was in your uncle does not mean you would have it. And just because it wasn't your father does not mean you would have it. Okay, I do get it. There's some studies that showed with twins the possibility of someone having it when one of the twin has it. But understand, it does not mean that it would. I mean, when you have a family predisposition, right? You have a family propensity. When it comes to genetic factors, it does not mean that because it is somebody in your family has that diagnosis, that means you would also have the diagnosis. Even we as providers, when we ask that question, it's just so that we are aware that, okay, this is something that is in that family. It does not mean automatically you're going to have that. So genetic factors, that's one, okay? But again, just because, and also one more thing, when it comes to genetics, just because you have a genetic or it's in your DNA, for example, let's just put it that way. Let's say there's nothing like, depression DNA, okay? There's nothing like, schizophrenia DNA, okay? Understand that. There are multiple factors that causes for there to be an expression, even when you have the genetic alleles or the traits. So just because you carry, somebody in your family had, let's say, bipolar or depression, or they had schizophrenia, or they were undiagnosed, right? Does not mean that you are going to have it or your children are going to have it, okay? So there are a lot of factors that we look into when it comes to mental health. This, again, genetic factors is just a risk factor. It does not guarantee or mean that you would have exactly that or that it runs in that family. So don't be carried away with the whole historical background, because trust me, there are people that are undiagnosed in that family. Somebody might tell you no, they don't have it, but does not mean, or they can even tell you that nobody in the family has it. Trust me, just because they don't have a diagnosis, that's probably the only thing that is a difference. They don't have a diagnosis. So that question is not necessarily valid. That's point number one, okay? Point number two has to do with biological factors. So what do I mean by that? Biological factors, we are talking about the iron flow. So we have the sodium channels, different ligands and neurotransmitters in your body, right? So these things are going, if there is an imbalance in your iron levels, or, when it comes to neurotransmitters, or even your hormones, this can definitely add on. This can definitely increase your risk, okay? Understand that your brain structure, having diabetes, UTI, cardiovascular issues, even cancer, functional abnormalities in your body, right? If you have diabetes, or not saying because you have diabetes you will have, mental health condition, but the point is that if you don't take care of your health, your medical health, that can affect your, it can also affect your mental. People that have UTI, if it's not well taken care of, they can actually have psychosis. And we do see this in elderly. Mental health, there's a lot of factors that affect it. So don't forget, number one, we said genetic factor, but that's just 1 out of 6. Just because you have a genetic trait does not mean it will be expressed. And number two is the biological risk factors, which I expressed are, disease processes, cancer, diabetes, diabetes, hypertension, stroke, any medical condition pretty much can also cause you to have, mental health conditions. Just like mental health conditions can also cause you to have medical problems. So what do I mean by that? For example, if you're depressed and now you're overeating, now, you probably can overeat and then you have prediabetes and then diabetes or even high blood pressure and so forth, or even cancer. So those two go vice versa. So number 3 is your environment. Number 3. Now, this is a big one. What does environment entails? Now, 80%, right? So number 1 is stress. Stress is a big one. And 80%, when you have about 80% of stress, this can affect big time your mental health and also your medical health. It can increase the susceptibility of having cancer, stroke, all that medical conditions, alongside your mental health. So stress is a big one, okay? So when it comes to your job, where you work, the money you make, or poverty of mind, so when I say poverty of mind, you can have a lot of money and still have poverty of mind, and that would definitely affect your mental health. Another thing can also affect your mental health is your social economic status, the work you do, your trauma stemming from your childhood years, where you grew up, your parents, where you lived, what occurred to you, the environment you were in, exposure to substance use, including marijuana. Marijuana, actually, people don't know, but we actually do see a lot of patients, cannabis, right? Yes, don't get it wrong. I'm not saying for some people, yeah, that's great for them, right? It works with the genetics. For some people, yeah, you're gonna end up in the emergency room or probably have a psychotic episode. So on some people actually have substance induced, right? Mental health condition. We do have a diagnosis exactly called that. So substance induced psychosis. Sometimes, it can also even lead to schizophrenia. So those are things, or even delirium or delusional disorders, or paranoia. So you want to be mindful. Some people do have this, so it may not be working for you, okay? So not everybody needs to be doing marijuana, okay? I'm not saying it's cool for some people. It may work for some people, but it may not work for you. So be mindful. So substance induced. 4 is going to be your psychological factor. So psychological risk factors. What do I mean by that? So when I say psychological risk factor, it has to do with your mindset. It has to do with your cognitive, right, processing. It has to do with your coping mechanisms. It has to do with your personality trait. Yes, you listen. A lot of people don't understand, but I know people often use the word narcissistic. They use it up and down in the wrong way. Just because someone is self-confident does not mean they have narcissism. Okay, so keep that in mind. But again, a lot of people, you'll be surprised, a lot of people on social media, you may think it's cool, but unfortunately, they actually do have a personality disorder. So not everything you see online you want to copy, okay? So keep that in mind. And even on TikTok, keep that in mind. Not saying people on TikTok have, personality disorders, but my point to you is that different people they have different personality, and sometimes we do have personality disorders, okay? So this also has a lot to do with your mental health and the risk factor. Yeah, and most of this time is stemming from, how you were raised as a child. So keep that in mind. That's number 4. So we're now on number 5 out of 6 of the risk factors for mental health conditions. Again, these are risk factors. It does not mean one of them is the cause. It just means multiple things can cause or lead to mental health condition. Number 5 is going to be developmental risk factor. Remember I spoke to you about the psychological risk factor, and part of that also has to do with your upbringing, right? So this also has to do with the way you were raised by your parents. Developmental risk factor, just you reaching different milestones when it comes to even your own personal development. We can't put every blame on all parents. Understand also your own development when it comes to developmental milestones. That also matters when it comes to your developmental risk factor. If there is a delay, that could also cause some neurocognitive or neurodevelopmental issues as you grow. Big role in that. Doesn't necessarily mean it equates, but it plays a big role when it comes to the risk factor for having a mental health condition. Sometimes parents they want to be the perfect parent. Understand that makes you feel good as a parent, but actually it actually can be very detrimental to the development of your child. Because now they have no resilient spirit. They do not know how to or they have no coping mechanisms. So it is again, therapy helps. Understanding your children helps. Having an open dialogue with your children, that is very helpful. Understanding why they think the way they do or why they reason the way they do. Understand when you're as a parent, you're shaping and molding the child, right, to become a better individual that can stand alone. It's not that you are going to carry the burden on your back at all times, and to the point that you don't allow the child to even have free to be able to explore and discover what they want or what they like or what they don't like. So UBridge Health, even we will provide you some some in-moment support counseling, and of course we can always direct you to the right type of therapist if that is needed in this journey of mental health condition. My name is Doyin. I'm a provider at UBridge Health, where the journey begins with you. Number 6 is your cultural risk factor, and cultural risk factor, I'm going to dissect that and also add on religion beliefs, right? Your religious belief. Religion is a form of self-care. Believing in a higher power, that is a form of self-care. But understand at the same time, sometimes depending on the practices of a religion, that could be detrimental to your mental health. Okay, so please use sense, okay? Some sense too, because you don't want to use sense to the point that it's going to lead you to death. So please make sure you use a little bit of your judgment and your discernment when it comes to the cultural practices that you do engage in. Okay, religion is a form of self-care, but again, you don't want it to be detrimental to the point now you're losing your mind, okay? When it comes to cultural factors, we're also referring to the social or societal norms and the stigma when it comes to mental health and mental care, or even access to mental health services or care. All of this also plays a role when it comes to the risk factor for your mental health or having a mental health condition. Understand culture, religion, society norms, society values or stigma, access to mental health care. All of this also affects our mental health. So remember the conversation, right? I told you I was going to gist you. So the gist began with the conversation regarding two individuals that went on a date, and one of the individuals that was on the date did ask one of them about their family history when it comes to mental health condition. Okay, so we have already dissected the risk factors for mental health condition. Understand that this does not guarantee that you will have a mental health disease or condition or illness. As at the same time, 1 out of 2 people, don't get it wrong, do have in their lifetime some kind of mental health condition. Now, apart from 1 out of 2, we personally, everyone is not above life and understand that. Remember I was saying, right? Life is life and nobody's above that, even including your providers. At one point in time, myself, anyone listening to me right now, we have all endured or went through something that really shook us to the core. And so that's, so when it comes to the percentage of in your lifetime, you will possibly have, let's say 1/4 of your life, you will endure some kind of mental health issue, whether you're diagnosed or undiagnosed. Yeah, we are all the same. And there's nothing wrong with people getting the care they need. We spoke about 6 risk factors for mental health condition. Number 1, anybody remember? If you remember, please go ahead and comment down below. But remember what I said, right? Number 1 was what? Genetic risk factor. Just because you have a genetic predisposition, or better yet, just because it runs in, maybe your uncle had it before, or it even runs in your family, does not mean that you would also express that trait. You can carry the genetic trait, but it may not be expressed because of the other 5 factors that I'm going to mention. So number 1 was the genetic, right? Genetic risk factor. Number 2 was your biological risk factor. We spoke about the medical diseases and how medical issues can also affect your mental health, and how your mental health can also affect your your medical issues. So understand that, okay? So this also includes your UTI, cardiovascular issues, diabetes, cancer, and so forth can all affect your mental health when it comes to, when it comes to having a mental health condition. Okay, so UTI can also definitely lead to psychosis if you don't know that. Number 3 is environmental risk factor. And I told you guys, this is the big one because stress is a big part, right? Stress, where you lived, how, the environment you were in, traumatic experiences, right? All of this shape who we are. And sometimes we have no control over that because 0 to 6 around that age, you are, right? You're exploring the world. You're getting to understand, your environment. And sometimes if it's not shaped properly, that would affect your mental health. I also spoke about, where you work, right? The kind of bosses you have, the poverty of the mind, even if you're rich, or even your social economic status, or even access to care. All of this can affect your mental health. This is all part of the environmental risk factor. Additionally, we also have substance use. And when it comes to environmental risk factor, that could also affect your mental health. So don't forget, marijuana, yes, for some people, they have no issue. For some others, guess what? They have psychosis or even schizophrenia or depression or paranoia or delusion disorders. Number 4 is your psychological risk factor, which has to do with your, part of it is your cognitive, it could be cognitive reasoning or distortion of it. It could also be personality traits, right? Coping mechanisms. All of that is all part of your psychological risk factor. Number 5 is your developmental risk factor. Where did you live? Right? Who raised you? Did you meet your developmental milestones? All of those things can affect your mental health, make you have a risk to mental health issues. Again, it does not guarantee. Okay? Now, number 6 has to do with your cultural factors. And I mentioned to you that that would include, right, both even religion, even though it's a part of self-care for some. Understand that it can also be detrimental, depending if you're not using your oblongata medulla, okay, or your senses. Please make sure you wake up, okay? Don't let, religion is great, but don't let the practices derail you to the point that you lose your mind. So again, keep that in mind. I also spoke about societal beliefs or norms, right? Access to mental care, or even the stigma, societal values, carrying that on as your own. All of this can affect your mental health. So, out of the 6 that I listed, right? We said genetic, biological, right? Those are the scientific portion. The other few that I mentioned has to do with your environment or where you were raised. So we spoke about psychological, we spoke about developmental, we spoke about cultural, and we also spoke about your environment. The 4 things that I mentioned, 2 out of 6 is just genetic and biology. The others has to do with your environment. So people often think mental health is as a result of genetic. No, you can carry a genetic trait. Just like in that story about the date, right? So you can carry a genetic trait. It can run in your family. It does not mean that you will express that trait. If you can control your environment, if you can protect your peace, if you know yourself and your personality, if you were raised in a better home, you may not have this mental health condition, even though you may carry the genetic trait. So protect your mind, mind your mind. And don't forget, even though life is lifing, we are here for you at UBridge Health, where the journey begins with you. We help you understand who you are. And we also provide medication and also we provide talk therapy alongside with our medication management. Of course, and we can always refer you for the necessary or the type of therapy that may be needed for you. We serve all ages. And again, my name is Doyin. I'm a psych nurse practitioner at UBridge Health. So don't forget to follow me, share this video, and trust me, this is going to help somebody. We need to break down the mental health stigma because all these things people have been talking about, mental health is not the way you think, okay? You can get the help you need today. And I'll talk to you guys more next time. Thank you. Bye for now. Don't forget, please be sure to like, share, and subscribe. Thank you.